What causes copay collection errors during telehealth virtual visits? Imagine trying to pay for a virtual visit and finding out your payment didn't go through. It can be frustrating for both you and your healthcare provider. Copay collection errors happen more often than you'd think during telehealth visits. Several factors can cause these mistakes, making it harder to get paid correctly and on time. One common reason is poor communication before the appointment. If the healthcare provider doesn't clearly explain how much you owe or what your insurance covers, you might be unsure about your payment responsibilities. This confusion can lead to delays or even avoiding payment altogether. Patients need to know exactly what their copay is, whether it's $50 or more, and when it's due. If this information isn't clear, errors are more likely to happen. Another issue is not verifying insurance details during the scheduling process. Many telehealth providers skip checking your insurance eligibility beforehand. When they don't confirm your copay amount upfront, surprises pop up after the visit. You might discover you owe more than expected, which can cause disputes or delays in payment. Confirming insurance coverage early helps prevent these misunderstandings. Outdated payment systems also play a role. Some providers still use manual processes to handle payments. Mistakes like entering the wrong copay amount or applying a payment to the wrong patient account happen more often with manual data entry. When billing systems aren't integrated with scheduling and clinical platforms, errors multiply, making collection harder. Payments can also be misapplied. Sometimes your copay gets credited to a different visit or service. This confusion makes it seem like you haven't paid when you actually have, leading to follow-up calls and delayed collection. Administrative overload is another factor. With more virtual visits, staff may fall behind on billing follow-ups, causing overdue balances to pile up. Without timely follow-up, collecting copays becomes even more difficult. Many practices lack flexible payment options. If you're asked to pay a high copay all at once and can't split it into smaller payments, you might leave the balance unpaid. Also, when systems aren't integrated, data transfer errors happen, making it hard to track who has paid and who still owes. This can lead to duplicate billing or missed collections. Higher patient costs are making collection more challenging. Many people now have high deductible health plans, so their out-of-pocket costs are larger. When patients see a big bill for a virtual visit, they might delay or avoid paying. Lack of clear billing explanations also causes issues. If you don't understand why you owe a certain amount, you're less likely to pay promptly. Finally, errors in coding and documentation can cause claim denials. When claims are denied due to incorrect codes, patients receive confusing bills that don't match what they expected to pay. This mismatch complicates collection efforts further. To reduce copay collection errors, providers should communicate payment expectations clearly, verify insurance details during scheduling, use integrated billing systems, provide transparent statements, and follow up on overdue balances. These steps help make the process smoother for everyone involved.